So we're going to work on hip mobility and internal rotation, which is bringing this top knee down toward the ground. Now this is kind of my sticky hip. It doesn't feel like it wants to go near as far as my right hip. I'm feeling a little bit of impingement in through here, okay? So we just want to start to improve hip mobility and start getting some internal rotation into our hips. So only go into a range that you feel is comfortable, not pushing too much into that anterior pinch. Right where I feel that pinch right here, I'm gonna come off of it instead of pushing through it. That just means that I need to start doing this one more on my left side, okay? So you would just do about 5 to 10 on each side. Okay, if you're comfortable, go ahead and get onto your stomach, and I want you to bring your hip up to about 90 degrees if you can, knee bent at about 90 degrees. You're gonna just relax your chest down, and we're gonna be lifting the lower leg up toward the ceiling, which is going to turn your femur, your thigh bone, into your pelvis. So we're getting hip internal rotation with a flexed hip, which is going to hit a little bit differently for your mobility. So we do want to challenge your internal rotation in different positions. Now, I just want you to know that we want to have the ankle relax and not leading up with the ankle. When we move too much at the ankle, we start to get irritation in the lower leg. And if you lift too high and you feel like you're going to cramp in through here, that's an indication that you're starting to get too far. Just kind of come on out of it, come back in, and just go to a limit that you feel comfortable with, but not to a point of cramping. And of course, we want to do both sides. Okay, so get onto your belly, bring the hip up, leg out, relax your chest, and we're gonna think about bringing the lower leg up towards the ceiling, turning the femur into the pelvis, not pushing into a cramp, just getting hip mobility of internal rotation with a flexed hip is gonna really help unlock your squats. It's gonna help reduce pinching, get rid of sacroiliac joint pain. So this is a really nice mobility exercise to add into your routine. Now the next one we're going to be doing, we're going to be bending both feet up, and we're going to be bringing your feet away from each other. So now you're doing hip internal rotation, again in a different position where the femurs are in the pelvis. All right, so we could always progress this one and put a little band around your ankle, something to push out against. This would be that would be a strengthening exercise, where if you're just using body weight like this, it's a little bit less strenuous. And we consider this more hip mobility, and this is a good place to start. It's not going to feel like a ton of movement, but you are starting to rotate the head of the femur in the pelvis, which is going to increase your hip internal rotation. And remember, internal rotation relaxes your pelvic floor. So this is a nice little gentle mobility for your hip and stretch of the muscles of your pelvic floor. This function. So I want you to get into a 90-90 position is what we call this. So hip, knee, and ankle somewhere around 90 degrees. Some of you might have to lean off to the side right here because it's going to most likely pinch or feel some symptoms in through here. You shouldn't have any cramping, sharp pain. That's way too much. So if this is painful to you, I don't want you to do it. You can tolerate it. I want you to do this. All right, so we're going to eventually try to bring our torso where our chest and our belly button are facing forward. And you can just try to shift your pelvis onto your femur, okay? So what I'm doing is I'm coming off the leg bone. Now I'm moving my torso, my pelvis onto my leg bone, which is going to be hip internal rotation for your back leg. Okay, so this is a great one to start to increment into. If you need to lean off of it and get into there, you can. So start leaning off. Can we lift this back leg up? Okay, some of you might have a severe cramp in the back of your hip, and that's okay. That's just something you're not quite ready for yet. So start with just stabilization first. If you need to come out of it, come out of it. I started to need to come out of it. And we can switch sides. So now we're going to do the other side. And am I able to shift over onto this side a little bit more? Or are you still over here? Okay, so this is going to be something you can do switches for mobility, and we can come in and out of hip internal rotation, right? So we're starting to bring, this is the leg that's turning internal. As I turn this way, we're turning it into the hip. That's internal rotation. So we need to start getting a little bit more mobility out of your hips and not only flexibility. Let's make sure our joints are also moving well. This is a big part of the underlying cause of why you're having your symptoms.